And welcome back. Well, we most often think of doctors helping individual needs of patients, but today we're going to talk about something a little bit different.
Yeah, thousands of local doctors are banding together to end a big problem in the Milwaukee area. It's homelessness. And joining us now from the Medical Society of Milwaukee are the past president, Dr. Michelle Graham, and the current president, Dr. Amar Ambardakar. Great to see both of you.
Thanks for being here.
Thank you for being here. We were kind of grilling them during the break about CPR because it's people want to have the confidence to step in, and it's also good if you also have the training. But both of you have actually performed CPR outside of a hospital, right?
Yes.
Yeah. Do you think most people don't know just the basics of CPR?
You know, I think there's actually a growing trend for education, and more in our community are actually getting educated because of the ability to make a difference in people's lives.
Mm-hmm. American Heart Association has a lot of good information about that. There's the new type of CPR is the chest compression only CPR.
Without the breathing part.
Yeah.
Without the breathing part.
Yeah.
Right.
Yes. A lot of people are nervous for the breathing part.
About that.
Yeah, and the point they say is not avoiding the chest compressions because you're afraid of, if it's a stranger, for example, doing mouth-to-mouth resuscitation. Right. Sure. It's okay if you feel the person is unresponsive, unconscious, doesn't have a pulse, to go ahead and do the chest compressions.
Exactly.
Thank you both for that. Let's talk about why you're here. You're both members of the Medical Society of Milwaukee. As members, what do you do? How does the group work?
Well, yeah, so the Medical Society has been around for a long time. It was founded in 1846, so before all the health systems, before all of that. And it was a group of physicians who could work together to help themselves, to help each other, but also to help the community. So that's where the foundation of it came from.
Yeah. Neat. Well, and you guys have this brand new public service announcement, and that's something where you've got the support of every large healthcare system in Milwaukee. I think it's pretty unique. Tell us about that.
Yeah, so our new initiative is to help homelessness. So we've partnered now with the Milwaukee County Housing Initiative, and we've made a donation for $100,000
wow.
to have 2 housing health navigators. Michelle, maybe you can talk more about what housing health navigators will do.
Sure. So we're really trying to impact the homeless in our community as well as our fellow physicians' lives. So we're supporting to have 2 housing for health navigators, which is a little different. And what that means is actually empowering physicians in their office to be able to pick up the phone and call someone. So if they're in a 15-minute visit, if they're in the ED and there's someone with housing insecurity and they need a place to live, we know that they can't help themselves in terms of health unless they have a safe place to live. And so this is actually a way physicians can make a huge difference and empower them to make a difference in our homeless.
It's really incredible. You know, for such a long time, people have known that the Medical Society has taken a real leadership role as it relates to the opioid crisis, for example. Some people, I think, may be surprised to find out that you're also taking a role now in homelessness. It doesn't seem like maybe a natural fit to some people as they think about it. But so why homelessness?
So a good way to think about it is just by an example. If I'm an internist, so I see patients in the clinic all the time. If someone doesn't have a home, it impacts everything. Like if you're, for example, if you're diabetic, you're on insulin. You don't have a home, well, you probably don't have a refrigerator, you don't have a place to put your insulin. If you don't have a home, there's instability otherwise. So it's hard to, how do you get to an appointment? You know, how do you get to work? How do you afford any of this stuff?
Just the basics.
Just the basics.
Yeah.
So it's really a key part of social determinants of health.
I think the number you brought up, the $100,000, that's a really big chunk and can do a lot. What exactly will the money be used for?
Yeah, so it's going to help to fund 2 housing as health navigators. So the way that's going to work is, so if a physician sees a patient who's going through their health issues and, I'm getting evicted, or I'm not going to have a place to stay. Now, with this housing health navigator, the physician is going to have the ability to have someone who they can call and say, hey, talk with this person, they will help you to get, housing stability. That's a huge change. That is not something we've ever had before.
Right. Interesting to have a contact so that you can help connect someone, not just by providing them medical information or services, but then to get them connected with one of life's most basic needs, which is a roof over your head, which is incredible.
One contact. So not having to go through multiple
lots of different
routes.
people.
Because that's where people probably get lost.
Right.
Yeah.
And as you had mentioned before, this is really a landmark time for us. So one of the benefits of the Medical Society is we really bring together physicians from all of our healthcare systems, all of our independent physicians. And you had mentioned it's really a first for us. We have engaged all of the CEOs from all of the healthcare systems. Everybody has really been supportive and on board. And so seen that, and this is a great thing for us now.
Yeah, I'm glad you mentioned that because you have the support of every large healthcare system in Milwaukee. Is this also the first to have everybody in one video? Because we were looking earlier at your public service announcement, which is great, and to have not just the support, but everybody making a public representation of their participation in this.
I think it is.
It's the first.
Yeah.
And it's really exciting. I mean, that's part of the benefit of the Medical Society is we really represent diverse physicians from across all the healthcare systems, all of our independent physicians, all the different specialties of physicians, and it's a way we can really come back together to make a huge difference.
Yeah.
It's wonderful.
And I know you guys are having a membership drive where physicians can learn more about being a member of the Medical Society of Milwaukee County, right?
Mm-hmm. That's correct, yeah. So this is our big membership drive. We want physicians in our county to sign up and be involved.
It's fantastic. You have a wonderful website that people can visit for more information about what you're doing for homelessness and also the health, the housing navigators that you mentioned in our community, those contacts too. So if you would like to become a member, if you're a physician and want to become a member of the Medical Society of Milwaukee County, you can visit the website you see there on your screen. It's medicalsocietymilwaukee.org to find out more information and see what it takes to become a member of this fine organization. Wonderful to meet both of you.
Doctors.
Thank you guys.
Thank you so much.
Here.